guys, welcome to my channel. Thank you so much for coming back. For those of you who are new to my channel, my name is Mercy. I'm a BSN RN, and on this channel we talk about nursing, lifestyle, beauty, vlogs, and a whole bunch of other stuff. So if you would like to join my family, go ahead and hit the subscribe button down below, and also hit the bell notification button so that you'll never miss another video from me again. Today's video is going to be about the difference between hospital nursing and nursing home nursing. So what nurses do at the hospital versus what nurses do in nursing homes. So that's what this video is going to be about today. We're going to be breaking it all down. So before I go any further, I want to let you guys know that I have never worked in a nursing home before, but I have been at clinicals at nursing homes many times throughout my school career. And that's probably why I don't work at nursing homes, but we'll get into that in a little bit. But I have worked in hospitals, and I've worked a few different units, so I'm a little well versed when it comes to that topic. So first, let's talk about hospitals. As for me, I have worked neuro, I have worked med-surg, I've worked a telemetry unit, and I've also worked on an ICU step down. But the longest place I've ever worked is a med-surg floor. That is the example I'm going to give you, because as a nurse, in my opinion, if you worked a med-surg floor, you can work on any floor, because in my opinion, med-surg gives you a little taste of everything as far as what patients go to hospitals for. So therefore, I'll be talking about med-surg nursing versus nursing home nursing. So as a med-surg nurse, you can get any kind of patient, from a diabetic patient, from a heart attack, from a stroke, from a TIA, peritoneal dialysis, hemodialysis, C. diffs, HIV, STDs, just any kind of patients you can think about. As a med-surg nurse, you're going to take care of those kind of patients. And when you get hired on a med-surg floor, in my experience, I had at least 3 months of training. Is it 3 months? It's 90 days. So you get at least 90 days of training. So by the time your training is over, you've seen a little bit of everything. You're never going to be left alone as a nurse, especially as a new nurse. Usually the charge nurse is there to help you out. The nurse educator is also there to help you out. There are other colleagues on the unit. The nurse manager is there. There are also different resources like the policies and procedures for doing certain skills. So when I say med-surg nurses do a little bit of everything, I don't want that to scare you guys, because you will have the resources that you need in order to perform your job in most cases. Okay, so you do a little bit of everything, and you get to see a little bit of everything. And usually, from what I've seen, the highest number of patients that people get in the hospital is 6. I used to think it was 5, but I've been hearing a lot of 6 lately, so I'm just gonna say 6. But if you're in somewhere like a critical care, you're probably going to get 1 to 2 patients. If you're in intensive care, you're probably going to get 1 patient or 2 patients, but you can get up to 6 patients working in the hospital. So in the hospital, you're going to administer medications, you're going to communicate with doctors, you're going to communicate with the family, the co-workers, the caseworkers, the social workers, your fellow nurses. When you give shift reports, the charge nurse, the unit clerk, the PCA. You also do have a PCA that has the same team as you. So if you have 6 patients, that PCA usually has those 6 patients as well. Sometimes they have a lot more, but let's just say when you have 5 patients, you have a PCA that usually has those same patients that you can call on if you need help or if you need to delegate something. Okay, so you're going to do medication administrations, you're going to do some dialysis. I know from my floor we used to do peritoneal dialysis, not hemodialysis, but peritoneal dialysis, where you change the bag and you let the fluid go through, you change the bag, you add the new bag, and cap it when it's done. You do that, and then you're going to administer blood, you're going to do wound dressing, you're going to put in catheters. If there's a code, you're going to be a part of it. And sometimes you're going to be reading telemetry strips, and that's the heart monitor. For those of you who don't know, you're going to be reading the heart rhythms on the computer. And what else? There's just so much that you're going to do on the med-surg floor, and those are just a little bit of what I listed. And another thing you're going to do on the med-surg floor is do shift report. So when your shift is over, you have to give the patient to the oncoming nurse, which then requires you to know something about your patient. So you have to tell them the patient's current status, just everything. I'm going to do a whole video on how to do shift report, but basically you're going to do shift report. And then also, every hospital is different, so your job requirements are going to be slightly different. But usually that's the general idea of what someone who's a nurse working in the hospital is typically going to do. So now let's move on to nursing homes. So for the hospitals are patients who need immediate care, and usually those patients have a higher acuity than someone who's in a nursing home. And by acuity, I mean their status can change at any time. Some of them are sicker than others. Some of them need direct one-on-one care right away. Their cases are different. So these are more critical patients. But the nursing home is the patient's home, hence the name nursing home. This is where usually older people live. They live their regular life, but there's nurses and other staff members there to help them transition into their, final days. I hate to say it like that, but usually that's what it is. So these are not patients who are immediately sick. These are patients who are living in their homes. So the staff nurses are there to make sure they take their medications for their chronic conditions. So the word chron means time. So anything CHRON has to do with time. So if you have a chronic disease, that means you've had it for a long time. So the patients who are there usually have chronic illnesses or chronic conditions, so like high blood pressure or diabetes or incontinence or something like that. So those are people who have chronic issues versus acute issues. So the difference between chronic and acute is chronic is something, as I said, has been there for a long time and is probably being managed. Acute is something that happens all of a sudden. So a chronic patient can transition into acute, and an acute patient can transition into chronic. But going back to the whole comparison, usually the patients who are in nursing home are patients with chronic conditions. So the nurses in that setting would do almost everything that the nurse in a hospital does, but just on a different level. So this is one of the main reasons why a nurse at a nursing home could have up to 60 patients and a nurse at a hospital could have 5 patients. Because I know I touched on this topic before. I said that working in the hospital can be crazy at times because you can have up to 6 patients. And someone left a comment saying that working with 6 patients is a joke because they work with up to 30 patients. There's a big difference. The patients in the hospital are more critical. They need more acute care. They need more eyes on them. And the nurses are moving like that. The patients in nursing homes are, as I said, that's their home. You are managing their chronic diseases. So you'll be dressing their wounds every day. You will be giving them their blood pressure medication every day. The only time something goes out of the ordinary is if someone is having a stroke or a heart attack, or if someone broke their hips or something like that. But usually those patients are pretty calm, they're pretty mellow, and they're usually in their rooms or in the activity centers, and you just go around and give them their little medications. That is the reason why it's easier. I'm not saying it's easy. I'm saying it's easier for a nurse to have up to 30 patients, which is usually like the whole wing of the facility. So you start from the first door, you go down and you give Miss Jones her medications, and you go down the line until everyone gets their medications. And then if you have treatments, you do the same things. You go and do their treatment, versus at the hospital where you can have a patient that is stable and you can also have a patient that is acutely ill. And this is where critical thinking comes into play, because then when you get report from that nurse, you have to decide what patient is more of a priority, what patient you're going to see first. So then that is how you're going to make your decision. Do I go and see Miss Jones first because she's having heart issues? Or even though Miss Jones is having heart issues, should I go and see Mr. Brown, who's asking for, his, a cup of tea or something like that? So that is where critical thinking comes into play. Back to the nursing home. So the nurses in the nursing homes, they take care of a lot of patients. Yes. It can be overwhelming. Yes, I've seen it firsthand. It can be so overwhelming because I don't care how you put it. Taking care of 30 to 60 people in one shift, it's a lot for anyone. But you have to realize that those patients are more stable than a patient in the hospital. So those are the few differences that I can share with you. As I said, I've never worked in a nursing home before, just because there are certain things about nursing homes that I don't like personally. But that's a story for another day. I have, however, had many clinicals in nursing homes, so I've spent hours and hours on end in nursing homes, so I know a little bit about it. But there might be a nursing home nurse out there who may disagree with what I said, and if that's the case, please leave your comments down below, or you might agree with what I said. There might be a hospital nurse out there too who also disagrees with what I said. These are just from my experience, what I've seen. These are what I'm sharing with you guys. So I hope that answered you guys' question. If you like the video, please go ahead and give it a big thumbs up. If you haven't already subscribed to the channel, go ahead and hit the subscribe button down below, and also hit the notification button so you never miss another video from me again. And guys, if you guys really like the video, there's a good chance someone else out there is going to benefit from it. So please go ahead and share the video to all your social medias so that a lot more people will see and hear what we are talking about. And if you haven't subscribed to my vlog channel, I'm going to leave a link down below so you can go ahead and subscribe, so that way you'll get to see other things that goes on in my life. Thank you guys so much for your love and support, and I'll see you guys in my next one. Bye.